This is the Transition Series, Topics for the EMT. Topic 1, Workforce Safety and Wellness. In this chapter, we will review the importance of using standard precautions, discuss specific diseases of concern the EMT is likely to encounter, and identify strategies for EMTs to ensure their safety while working in the pre-hospital environment. Now more than ever, EMTs must employ multiple strategies to ensure their safety. We are being exposed to more and more diseases as patient volume and the prevalence of certain communicable diseases continue to rise. We must also be aware of the hazards in scenes that may pose a risk, such as motor vehicle crashes, scenes of drug abuse, scenes of violence, and other situations that may pose a risk to the EMT. We must always be aware of our situation and focus on our personal safety while we're delivering care. Deciding what precautions are needed should be done during the scene size-up. Gloves are a minimum, but the biggest error EMTs make regarding the use of standard precautions is making decisions about what to use before a complete assessment is done of the scene. Too often we will don gloves while exiting the ambulance and then find that when we reach the patient that more is needed. Gloves can tear while using equipment or accessing the patient, and that can pose a risk as well. Face masks and other respiratory cautions should always be considered. There are many communicable diseases carried by droplets and transmitted by sneezing, by patients vomiting, and by many other circumstances that are beyond the control of the EMT except in terms of protecting ourselves. So even though masks may seem silly at the time, it may keep us and our families from getting sick. Likewise, the importance of good hand washing cannot be underestimated. It's important when you're washing hands to wash them long enough. Be sure to wash them long enough to sing the birthday song. Use of alcohol-based cleansers is a good idea. In this situation, we find EMTs on the scene with little protection, even though they've already reached the patient. This medic is at the patient's side without gloves even donned. This gentleman is interviewing the patient face to face with a very short distance between their faces with no face mask. He has great confidence that the patient is not going to sneeze or vomit in his general direction. And this gentleman obviously does not expect to lay hands on the patient at all, since he does not appear to even be considering gloves. It's very important for standard precautions for PPE, for personal protective equipment, for standard precautions to be in a readily available location. EMS agencies are required to provide annual training for EMTs, as well as initial training, to help protect them from diseases. We should also make sure that we are comfortable handling sharps, that we understand the basics of equipment decontamination to ensure that our equipment is ready and safe for use, and that we are using disposable equipment when that's appropriate. This individual has inadvertently ripped his glove. If he has a cut and the patient bleeds into his cut, he has a high index of risk for transmission of a bloodborne pathogen such as HIV or more likely hepatitis. It's important to take precautions in a timely manner, not too early and not too late, and to take sufficient precautions. It's really important for us to be aware of the diseases that we are exposed to. A few examples of diseases that we are commonly exposed to include AIDS, the human immunodeficiency virus, which is transmitted via intravenous drug use, unprotected sexual contact, blood transfusions, and, although rarely, accidental needle sticks. Since this is not a robust virus, it pretty much has to be injected into the person being infected. So our big risk is in needle sticks. However, droplets can contaminate us with chickenpox, with German measles, with any form of the flu, including H1N1, the bird flu, meningitis, mumps, pneumonia, tuberculosis, and whooping cough are all transmissible through droplet contamination. So the use of masks is highly advised if any of these situations are even suspected. When we are on the scene of a crash or in any other exposed environment, it's important not only to wear high visibility vests, but to protect the scene by blocking the flow of traffic with apparatus, by using police cars and other emergency vehicles to upstream from the crash to alert drivers that they're approaching a scene, and to get off the scene as soon as possible, protecting the patient and the providers. The chevron pattern is increasingly popular to increase ambulance visibility. We often find ourselves in dangerous positions. We deal with the unknown and the unpredictable. When we find ourselves in a dangerous environment, the first critical step is to call for help. The next step is to use cover where it's appropriate, to conceal oneself when possible, and certainly to retreat if necessary. Here are some EMTs using cover and concealment. The greatest risk to EMTs, however, is back injuries. We're much more likely to suffer an injury lifting a patient than we are to be fired upon. The part of our body that is most critical in lifting is the brain. We should think about the lift, plan our strategy for the lift, and make sure that there is plenty of help. We should consider the location of the patient, the weight of the patient, and the average weight of a patient is much larger than it used to be, the capabilities of the EMTs, and the patient's conditions. We should also consider what equipment we have and what we might need. This EMT is lifting properly, back, straight, and her legs as the primary lift force. However, it's not always possible to lift using the legs, keeping the back straight. Frequently we find ourselves in awkward positions. When you must lift in an awkward position, take a deep breath and hold it, making the core of the body stronger and maintaining a stronger support for the spine. In summary, we should always use standard precautions according to need, not based on our assumptions about what might or might not be needed. We should be aware that any scene can deteriorate rapidly and be aware, situationally aware, to the dynamics of the scene. And be especially careful to only lift and carry what we can safely lift and carry. We should always call for assistance with moving patients whenever necessary.